briefly, I would want just want to give a chance to the institute directors. If Professor Kanyinga is not here, Paul Kamau will give us a word before Professor Paul Kamau can give us a word before we roll out. That's usually our tradition. We have a word from our directors and then we can continue. So Paul, the floor is yours.
Thank you very much, Professor Mitula, for starting us off. And good afternoon, good morning to some of our colleagues joining us from other time zones. We are very delighted to see all of you onboarded for this seminar. And as an institute, we endeavor to have the seminars every Thursday, as my colleague, Professor Winnie Mitula, has alluded to, so that we can have an opportunity to share and to disseminate research findings that for works that are done here in IDS and elsewhere. So this is a platform for knowledge exchange, and we really would like to keep it vibrant, and we invite you to be joining us. We will be getting your details so that every time we have a seminar, we will be sending you an invite, and if your time allows and it's of a topic of interest to you, we be very delighted to have you on board. So on behalf of the director of the Institute for Development Studies, Professor Karuti Kanyinga, we wish everybody a very happy new year. This being the first seminar, we will be having a series of them as time goes by. But we are very delighted that researchers based who are making this presentation today on human capital development is a project that is anchored here in IDS and being done in many other African countries as other 7 African countries. And we're very happy because of the findings that are emerging. So mine is to welcome all of you and to wish you a very good participation and everybody has access in the seminar. Kageni Kagai kindly mute, and therefore I return the mic to the chair, Professor Winnie Mitula, to take us to the next level. Thank you very much, Prof.
Thank you very much, Professor Kamau. As I was just engaging with this topic and the presenter is quite into development studies and has done an array of work, especially in the field of health economics, poverty and inequality, development economics, fiscal space estimations, national transfer account, social development, determinant of health, and strategic plan development. So basically, if you listen to that, I can go on and on looking at his CV. He's been engaged in development, and there could be no better person placed to handle this topic. Shocks has become very common, especially post-COVID 2019. Most writing publications are on shocks and what shocks did to different sectors and to different households. So I guess this is a topic that we all can identify with, and we'll be keenly listening to Professor Muridhi so that we can engage after the discussants shall have engaged with the topic as well. So Professor Muridhi, the floor is yours. Can you project your PowerPoints? And I give you 15 minutes. If you slide off 20, and then we can have the presenters, the discussants beginning with, I think we will begin first with Professor Olayinka, and then we will go next neighbor to talk to Paul Lakuma. So let's listen to Muridhi. We can see the PowerPoint, so you can go ahead.
So thank you, and good afternoon, everyone. Yeah, so I hope I'm audible. I share.
You are audible. We can see the PowerPoints on my side. You are very audible. Go ahead. Are we losing you, or am I the one being lost?
Is that is at Biren Beridia on human capital development. which is actually pinched at ARC. Yeah, so the topic for the day is derived from the work that we have done, because actually there's a lot that we could report here, but given that we need to pick the key areas, we'll simply go into looking at what we are calling the shock on educational attendance in Kenya. And as Prof has alluded, there has been a lot of interest there was a lot of interest during COVID time to see how COVID as a pandemic was affecting several sectors of the economy, so that we could come up, or the country could come up with short-term policy or measures that could actually mitigate the danger of COVID on the sectors that are there. Yeah, so for us, we concentrated on the education sector, where we looked at COVID in terms of how it affects the human capital accumulation. Given that when we talk of human capital, we are talking of a human capital is a dynamic element of production. And what we know is that that dynamic element of production is actually interwoven with what we call a national endowment and capital accumulation, other capital accumulation, which are considered a static element of a production. So this then implies that for production to take place in a dynamic way, then we need to utilize our human intervention also in a dynamic way. Yeah, so in that case, and in that line, we think of human capital development as a dynamic. Being a dynamic in terms of changes, then we expect that we can change this human capital in terms of volumes, in terms of quality. So we can change it in two ways. We can augment our human capital through investment, and that is through education and health. We can also disrupt or maybe reduce this human capital through what we might call the shocks. And the shocks in this case could include illness, like the pandemic we have, or job losses seen by several others. Yeah, so in this paper, our main interest is to look at a given shock that all of us are aware of, and see how that shock affects human capital development in terms of planning. Yeah, so in terms of shock, we know that they threaten household welfare, and also in terms of school, there is the issue of affecting the ability to send children to school. We also know that shocks can manifest itself in several ways, depending on the nature and setup of the household. So it can be idiosyncratic, which means that the shock will affect a specific household in isolation, or it can be a covariate, which means that it can affect all the households simultaneously. Yeah, so for our COVID shock, we know that it was a covariate shock because it affected everybody simultaneously. Nobody was saved from there. So then, having known what shocks are about in terms of household, then we look at the COVID-19 pandemic as a health-related shock that has actually affected the entire globe adversely through its multiplier effect in all sectors. We also know that in terms of school, COVID-19 affected the way children experience education, and by extension, the learning capability. Yeah, so we know that access to learning technology during that period of closure, especially in Kenya, because our studies in Kenya, seems to have favored disproportionately the private schools people at the expense of public schools. So in that line, it is then contravened what we know in the SDG 4 on quality education and SDG 10 on reduction of inequality. Yeah, so in this work, we assess quality and inequality in education through a proxy of ability to acquire learning through various means, modalities like internet, radio, private tuition, etc. Yeah, of course, we know that worldwide, Kenya was not a peculiar in this because the whole issue of COVID was a global thing. So, as a way of attempting to mitigate the adverse effect of COVID on learners' outcome, different innovations were used, not only in Kenya, but all over the world. So these innovations, in many instances, were selective in nature, thus leaving large size of student population out. Of course, in Kenya, we remember we had the online learning radio program TV, but what we know is that a student, especially from public schools, stayed home without any form of learning. Of course, we have a report from the Ministry of Education that about 200,000 students never reported back to school, even after that closure. Yeah, of course, we know that. What is the issue here? We know that a lot have been done, just like we have been told by our chair, a lot have been done on the impact of COVID on many aspects on many sectors. But what we lack during that time, that particular time, is a systematic quantitative scientific evidence on the impact of COVID disease on school attendance in Kenya. And also we didn't have, hello, somebody? Also, we didn't have a very good evidence in terms of differential characteristics on the impact of school attendance during the same time, so that we can also bring the issue of inequality there. So then what we know is that having good evidence on these issues will and they can help with short-term policies, of course, aimed at a long-term goal for human capital development. Yeah, so having seen that as our key issue, then our objective for the paper was mainly to look at the impact of COVID pandemic on learning modalities, and also look at the magnitude of differential in learning modalities during the COVID in Kenya. Yeah, we tried to, we use this kind of conceptual framework where we are saying that we have a learning which is on a horizontal, on a vertical axis, meaning that is on an increasing scale, and we have the time period. So the time between T1 and T2, the time between T1 and T2 actually captures a period of shock. So we are saying that sometimes the shock can be disruptive, might not be disruptive, implying that learning can take place throughout, or sometimes the shock can just plateau, so that there is no impact in terms of learning, and also there's no more learning, but at least students still remain with what they have learned. But it can also have an impact where with the shock, it can also reduce, it can cause unlearning, or can reduce the learning in the long run. So this is the kind of conceptual framework we had in mind when we are coming up with this paper. Yeah, so to achieve this, we used, to achieve our objective, we used data derived from World Bank High Frequency Phone Survey, which was collected in 5 waves between May 20 and June 21. Of course, the waves were 5. We have the May to July, then July to September, and then September to November, January to March, and finally March 29 to June. So the data collected was actually on socioeconomic impact of COVID pandemic in Kenya. So the survey was implemented by the World Bank in collaboration with Kenya National Bureau of Statistics and the United Nations High Commissioner for Refugees, and also the University of California, Berkeley. So in terms of our methodology, we use the panel random effect logic control function model, which also took care of heterogeneity and heterogeneity econometric issues. In there, we had the school attendance was regressed on COVID incidence, and of course, other control variables. So what were the key findings? So in terms of the key findings, we found that increasing the proportion of children with COVID incidence reduced the probability of school attendance by something like 2.3%. Then the increase in proportion of household head age reduced the probability of school attendance by around 4.5%. While again, examination classes had a high probability of school attendance than other classes across both private and public schools. Another key finding was that children in public schools had a reduced probability of school attendance by close to 0.27 compared to their counterparts in private schools. Within the public school again, children in urban schools had an increased school attendance probability of 0.08% compared to those in rural areas. So then we are saying that there were also differential within public school, with those located in urban areas being at a better position to transition to virtual learning. So what were the key observations out of this? We had 3 key observations. That COVID as a proxy for shock on human capital development actually affected attendance to schooling which was actually a proxy for learning. So this affected the quantity and quality of human capital to some extent, though this need to be tested. The other issue was differential school characteristic, of course, would lead to inequities in education opportunities. And also another observation is that the fact that examination classes had a higher probability of school attendance than other classes across both private and public schools actually was an evidence that Kenya schooling was highly exam-oriented. Yeah, so what were the key policies related to the results? So some of the key policies that we suggested is that given that school closure was an immediate reaction to COVID pandemic shock, it failed to address needs of children in different school setups. Then in future, such a shock, there's need to put some support measures for public private school to cope with such kind of shock. So things like acquisition of ICTs, gadgets, subsidized data bundles, and basic medical equipment that facilitated remote learning was part of what was not at that particular time. It be a good policy, a policy plan. The other issue was that in such kind of a shock, we can have some kind of targeted cash transfers, especially for the household heads who are aged, so that then the issue of us kids not attending school because of the aged parents perhaps could be reduced. Then there's also the issue of educating that particular time, educating or creating awareness among old people about shocks like COVID, so as to take necessary action if available. So like issues like the need for vaccination to boost immunity by then. Then we have we ended up with some key messages from this. The issue also of closure, or what we are calling the measures taken by the government in terms of what we call a closure and all that, affected the poor more than the rich, which then signaled more inequality in access to basic education. So then in boosting learning activities and school attendance, the public policy interventions implemented nationwide during the pandemic favored private schools as they benefit comparatively through internet accessibility and the physical policy measures. So then the key thing here is that government should provide better and targeted fiscal incentives to mitigate against such kind of disruptions, particularly among the vulnerable groups. So that is what I have, Chairman, for the day. I thank you so much for giving me this time. Thank you so much. Sand, back to you, Chair.
Thank you very much for that a good presentation. We really appreciate. I think we will not comment. I can see the chats are going on very well. We will call upon now the first discussant as people continue to engage on chats and prepare to engage at the end of the discussant sessions. I am now calling upon Professor Kani Olainka Lawson, who is a professor of economics. He holds a PhD in economics degree. Oh, which one is that now? Something is... Basil, check who is screeching us out. Okay, he holds a PhD degree with specialization in health economics. He graduated with the first class honors at the degree in BAD, Bachelor of Education in Educational Management Economics, and the second degree is Master of Science in Economics from University of Ibadan, Nigeria. Lawson is currently a lecturer in the Department of Economics, University of Ibadan, and Program Coordinator, Health Policy Research and Training Program, Department of Economics, Ibadan. I will now call upon Lawson to give us his responses to this. He has an elaborate CV with quite elaborate wide experience across multidisciplinary areas. So we expect him to be the best person to engage us first in this response to the presentation by Professor Murithi. Prof, the floor is yours. I can see you.
Thank you so much. Thank you.
Karibu,
good afternoon.
Karibu.
Asante sana.
Welcome. All right.
Thank you so much. Good afternoon, everybody. It's a privilege for me to have been invited to be part of this, to be a discussant to this paper or this project work. The topic is actually crucial, given the experience of the last 2-3 years, especially 2020, in terms of the pandemic that was actually global. There was no exception of any country that was not shut down during that period, and economic activity suffered. Many aspects of our lives were negatively affected during that occurrence.
Would those who are not mute be mute? Right now, we only want to be listening to Professor Akani.
He has muted himself.
Prof, you are muted.
I'm not muted.
Okay, now muted. Good. Go ahead. Okay, right. We saw you muted.
No, I think it was a general muting.
All right.
It wasn't one.
Okay.
Okay, all right. Okay. Like I was saying, I said that the issue of the impact on the educational sector is also a very important thing. Once we come to about the human capital focus of this work, it is the fact that the two components fundamental to human development happen to be affecting one another here, and that is the basic focus of this study. The health aspect, which the pandemic directly hits during that incident, actually is having a spillover effect on education in terms of the policy measure that nations were compelled to actually embark upon during that period of time. So I find it actually interesting to investigate this kind of study. Now, let me go to the meat of the work. Now, the foundation in which the way it was laid and into the issue of human capital framework is very, very crucial. Direct studies have shown relationship between health status of individuals, household, on ability to develop in terms of education. Someone who is sick who is down may not be able to have what it takes to actually embark on education. And this is very interesting. Now, fortunately for this study, they relied on Wombat data, which actually have been collected. But one thing I found out in the analysis is that a good analysis has been done in terms of the functional analysis, and then the one on the logic model, which focus on the looking at where at the end of the day, it's the random effect that the Osman test actually suggested. My focus will be in terms of what I need to say. I don't want to discuss this paper again as a discussant. The presentation has been made, that's the paper itself. But I will be talking about things that I think is crucial for improving this paper and actually taking it and letting it have the full complement of a good paper at the end of the day. One fundamental is that a number of interesting stories or results were obtained. However, the story behind those results were never told. When reporting that 1% change in something on any particular variable, like for instance, the head of the family or the child being the head of the being belonging to the head of the family, has implication in terms of attendance of school, is just reporting what is in the figure in words. I just see it as a kind of prose presentation of what is already on the data. Where this study speaks to the population. You see, one thing we must understand is this, and what I want the authors to understand is the fact that you should see this paper talking to policymakers, talking to people who will take measures. That's why you have policy implication. Now, this set of people, telling them figures does not carry them along. Telling the story behind the figure is what catches their fancy and will actually help them to be able to navigate and use your report positively for the benefit of Kenya. Now, a number of interesting results I may want to be going into. Let me start with the issue of the, what do you call it? The summary data, the descriptive summary of the data that were used. There are a number of figures there that need to be revisited that actually is raising a number of questions. Now, you have collected data on individuals and you have information about, I'm coming please, just 1 minute. You have collected data. When you get to descriptive analysis, you begin to talk about issue of the educational sector was distributed into three. You have those who don't have education at all, pre-education, then you have primary, and then you have secondary. Now, the statistics that you do have there, I expect it at the end of the day, because each of the respondents in that survey must have picked one or the other. More so that you limited the age bracket you are dealing with to 5 to 17, which are the set that should be of school age. That is understandable. But I expect distributing that percentage to give you a count of 100%. But that's not what you have in terms of where you're looking at the summary of the statistics you have there. Then also in your discussion of rural, I thought the public and private. If you go and look the percentage of the children you said, students that you said are schooling in public, I think you wrote 84, and then 36 for private. Then that does not sum up to 100. That data needs to be revisited and able to actually find out what could have gone wrong there. Now, part of the interesting stories or interesting results that I actually saw in the paper, one is this child belonging to a household head reduces the probability of school attendance by 0.2. Now, I believe going through autism, a parent will be more interested in the human capital development of his own sibling, of his own child. And so interest should have been in terms of positive impact on being able to attend school because the child belongs to the head of the family and not a child that is that household, but not given birth to by the head household. That is the fundamental theory we want to talk about. But when you say present this in the control for pandemic, and given the nature of distancing, in terms of shutdown that we actually experienced, I want to believe that the story behind this result can emanate or be explained from the perspective of the fact that an house or a head of household is more interested in keeping his child away from where he can mingle and easily contact or be infected by that COVID-19. That might be the reason why you have children whose head household is actually their parents holding them back from going to school, compared to those who are not direct a child belonging to the head of the family. The same thing is applicable to transportation. When you grab the result in terms of transportation, you talk public transport. You gave us information about the fact that that transportation basically has a negative effect in terms of affecting COVID-19. When you are looking at the issue of COVID-19 now being the dependent variable, and you're looking at public transport as one of it. Now, the story behind that has to do with the fact that public transport means that you mingle with different sort of people that you don't know their background and their health condition. And it makes your being susceptible to actually be infected by that disease is one of the reasons. The story behind this interesting result need to be told. And that is what is currently absent in terms of what we have here. And if you look at it, because you have only reported results and have not discussed those results, you will see that it's actually affected the policy implication you are able to come up with. They are scanty, they are very small, and they are basically not even be said to be directly derivable from the result you have actually obtained. So you have a situation whereby you have less than half a page of policy implication of just 8 lines. That is grossly inadequate for this kind of a result that you do have in this place. Now, you have some result that you actually also discussed. You talk about the issue of serving meal in schools, reducing the probability of attending school. Naturally, when meals are served in school, pupils are attracted to come to school. And so in one of the policy, apart from the nutritional value that it brings, is the fact that it serves as a kind of incentive for children to want to come to school. But when you are controlling for COVID-19, the interest or the benefit or the utility of going to school to eat cannot be compared with the safety of the life of those children. And that might be responsible for that decline. Now, when you now try to compare that one to the result of PANA at 2020, now you also look at that result. It's not the same thing as your own, because they are looking at it inverse. They are saying if children that goes to school are more likely to be served meal. That is not what you are looking at. You are looking at being served meal makes you to come to school. So using it as the basis for the contradiction of your result does not come or is not applicable in this kind of instance. So you need to actually tell the story. Also, another indication, another result that was reported, not discussed, is the issue of the mother employment. You notice the result shows that mother employment reduces, increases the attendance to school. Now, that is natural. When a mother or the parents are engaged in active economic activities, they are actually not having time to provide the home care for their children. So when they are not at home, they see education, schools as an escape route for them to put their child in the meantime, and so that they can actually be occupied there. And that is the story behind that. So I want to advise the authors to go through each of those results. And that's why I've given a number of examples, given the limited time that are given to me. Look at each of the story, the report you have reported, and have a kind of discussion. Why would this result come here? You can explain it. They do exist. So it's not sufficient to say your result is contradictory or your result is in line with another person's own. That does not. You can look at more unique reason why you obtain the kind of result that you actually have reported in the paper. Thank you very much.
Thank you very much, Professor, for taking time to listen and to engage with the discussion, and for that contribution. We'll get back to you later when we are discussing and responding. Now we want to call upon Mr. Koti Paul Lakuma, who is a senior research fellow and head of the macroeconomics department at the Economic Policy Research Center, Uganda. He holds a Master of Science in Economics with distinction at the University of Essex, United Kingdom, and BA Social Sciences from Makerere University, Kampala. He is an established forecaster, economic model builder, and advisor with more than a decade of service to government and international organizations. He has advised the finance ministry in Uganda on microeconomics and fiscal policy, fiscal institutions, and revenue administration. He has also worked on domestic resource mobilization strategy to the medium term for Uganda, where he authored numerous diagnostic papers to inform the reform process. I think we are very lucky to have you, Paul. So the floor is yours. Can you also engage with these preliminary findings, as I may call them?
Yeah. Thank you, Chair Winnie, Professor Winnie. Yes, this paper, can you hear me? Yeah?
Yes, very clear.
Okay, yeah. Yeah, this paper, it's a good paper, like the previous discussant has mentioned, the professor from Nigeria. The paper makes great contribution to the education discourse, especially broadly to the human capital development discourse, but more narrowly to how individual characteristics, household characteristics, community characteristics, and educational differential can contribute to capital development through the school attendance channel. However, there are a couple of issues, as the professor has mentioned. Maybe I'll repeat some of them just to reiterate. I feel the abstract can be summarized further to focus mainly on the problem, the methodology, and the results, and the policy recommendations only. Right now, the abstract is quite broad, and there are things, it can be edited further. It can be made much more smarter, much more attractive for a reader to be interested in reading the main paper. Let's go. My discussion will be guided by your results and your summary statistics. One of the questions: what's the difference between COVID-19 incidents? We have it as a variable in the first baseline. I would call it the baseline. You call it the reduced form. I'll call it the baseline. It's the first regression. Then you get the residue of that, and that's what you attach to the second stage regression. You're doing kind of a 2 SLS, where the first stage is a linear probability model, and the second stage you use the random effects. So what's the difference between the incidence of COVID and the county level incidence of COVID? I know the one is subnational and one could be at national level, but there's likely to be high correlation in the first level regression, and that would affect the validity of that instrument. Why? Because of it could be a little bit endogenous and not exogenous, as you state in the paper. So, but you will explain what's the difference between county level incidence of COVID and national level incidence of COVID. National as a dependent variable, and the county level as the explanatory variable in the reduced form regression. Yes, the impact of some of the results which I explained, I know it's not good to focus on significance of this, especially when you're writing a policy paper. But a lot of the results which I explained and assumed to be the support base of this paper are insignificant. A lot of the results are insignificant. I'll point some of them, and there's need to point it out or to focus on the significant results first, then run to then run to the insignificant later. But make it clear that the results are insignificant. Like one of the results is give me a moment. Gender of the child is insignificant in the second stage regression. Child of the household head is insignificant. Log of the household income is insignificant. Log of the age of the household head is insignificant. Mother employed is insignificant. Father employed is insignificant. School meals is insignificant. Then the pre-primary education level is insignificant. I think you need to point out this, though the signs point to what you would expect, what is expected has been pointed out in the past literature, but you need also to be honest, and you point out that these results are insignificant. And insignificant results, there's little you can say about it. The sign may be in the right direction. Yeah, the scalar is in the right direction, but the magnitude is not significant enough for you to make a conclusion about it based on the data. Maybe the data was not sufficient. So the magnitude of your variables is not significant for you to make very strong conclusion like you make in the paper about the results you get. So I think you need to go back, like the professor said, and also look at those results, the ones which are insignificant, and probably as you explain them, you also point out that the magnitude of those coefficients are not enough for you to make the conclusions you make. And you focus and the strong conclusions you make should be based on the significant results. That's one of the key things I found in the paper, which you may need to look at. Then school meals, like the professor pointed out, you would expect the literature and even common sense would expect students to attend school, especially students from public school. When there's a meal in school, you'd expect students to come because there's something to eat. But in your results here, they are counterintuitive. That meals are provided in school, but students don't turn up. I think it could be true. I think, but you need to look for the explanations, like the professor said, and try to justify why the Kenyan case is unique. Age, the results suggest that the older you are, or one more year you add to your age, the less likely your child will attend, would have another day of schooling. Yes, but I think we need to know the threshold. The threshold pointed out in the summary statistics. In the summary statistics, when it comes to age, we have the minimum is 18 and the maximum is 110. I would expect the people, this is quite a wide dispersion, although the dispersion is valid since the CVs for that variable are really, really small. They are lesser than 20 or 30. When they're above 20 or 30, then you'll be concerned. Here, they are even in 0 point something. So it's really, that shouldn't concern us, but the data it's too much dispersed. However, I expect people who have reached 60, 70 are the ones who are having trouble enforcing school attendance on their kids. But people below 40, maybe, enforcing school attendance wouldn't be a problem. So probably you introduce another variable, which will be age squared, so that we know the threshold. From the summary statistics, it will show us the threshold. Yeah, and if that variable is significant, we would know that probably if you're below 40, the age wouldn't be a problem, but above 40, probably that age. I'm just giving that as an example. It's not like I have read it somewhere in the literature. No, I'm just giving that as an example. So let's have another variable. Let's make that variable nonlinear, so that we can know from the summary statistics, we'll be able to tell at what age is the threshold where enforcing school attendance becomes a burden to our parents. That will also be very good for policy. And then in the interpretation of the results, we need to recognize the base. What are we comparing this with, especially for the dummy variables, for educational level particularly? From the summary statistics, no education level is in the summary statistic, and the regression is not there. So I'm assuming that was the base. So we are comparing school attendance at various levels with no education, with people who didn't go to school. So that needs to come out in the explanation that, all right, for example, one explanation would be that for pre-primary education level, attendance reduces relative to those who didn't go to school. So those people who didn't go to school, probably the households which did go to school, probably when compared to households which have children at pre-primary level, yeah, the attendance of households who have children at pre-primary education level is likely to reduce compared to people who have children who are not schooling. And it sounds kind of counterintuitive. That's why also choosing the base would be good. It's always good to choose the best example, not compare those who have children in school with those who are not in school. I would have secondary school, secondary education level is the highest here. I would have that as the base. I would drop that. I would bring those who have no schooling. But again, those who have no schooling with school attendance, it's kind of counterintuitive. Maybe you need to look at that that variable again. Why would we have a category where there is no schooling in matters which concern school attendance? It doesn't make sense. So probably we will need to drop that so that we can have a better base for comparison. Because here, once you have no schooling in the data set, the interpretation here is that every other variable which concerns education level must be compared with what was dropped to avoid the dummy variable trap. So I was thinking maybe you look for another one so that the comparison makes sense and it's not counterintuitive and doesn't go against the grain, unless you have very good explanation, like the professor mentioned earlier. Then on the policy recommendations, I also agree with the professor that a lot of the proposals you make, they are good on providing an income transfer, on technology, the use of technology, but they were not in your variable. It's good, but they are remote. These variables were not in your data set. If the data set you have does have those variable points, please bring them and interact them with some of your key variables, and let's see which direction the results will take and what will be the magnitude of that result. And then you can have very concrete policy recommendation. We can agree, then we will be able to agree with you, because income transfer is an expensive policy if we are to implement it, especially for a developing country like Kenya. So it's good that if I know Kenya provided some income transfer or has an income transfer system, if that data is available, can it be interacted with your key policy variables in the model? And let's see whether that message is coming out so that we can make concrete conclusion. Otherwise, the policy recommendations are good. They are related, but they are remotely related because we didn't run them in the regression. It's good to recommend something which you have run in the regression. Thank you, Chair. I'll stop there.
Thank you. Thank you very much, Paul Lakuma. That was really, really good. Considering that this is an ongoing work, I must say that these are very good insights. It's not like, discussing a paper which is concluded and published and people are just listening and saying, well, those are not useful comments. They've been very useful. And before I call upon the team, which is not just Moses, I know his other colleagues are also around who are involved in this research, it would also have been useful to give context. Like when you talk about the three waves, these three waves, how were they structured? Were they falling on the same household or whatever? So there is a bit of that context missing that could also be leading to this. And again, when I look at shocks, and I've read a lot about shocks since COVID-19, I think sometimes we're using the normal variables, like the normal socioeconomic variables, and to a large extent, most of these variables that are being questioned or being said to be insignificant, they should be insignificant actually in the context of shocks. So I think these are the kind of issues that needs to be interrogated deeper in this particular kind of study. And again, for example, when I saw one of the, I don't know whether it was key messages take home or a policy recommendation, but this issue of educating old people, I just didn't understand where it's coming from and why old people, because COVID was a shock and COVID was something that we were all learning, and there was nobody who had knowledge of COVID. But in this case, it's more of educating old people on COVID-19. So I think there is a lot to be clarified in terms of just giving a good context and also letting us know the areas that are still being, worked on in terms of teasing out what should be. So my colleague, Professor Murithi, when you are replying, you could also give us a bit of context. We still have about 30 minutes. We can give you and your team about 5-7 minutes or so that we get that context before we have everybody else join into the discussion. Murithi, the floor is yours, and you can call upon all other colleagues where necessary, or they can jump in. Thank you.
Yeah, thank you so much. Yeah. So the I don't know whether by context you want me to go all through the through our discussions and also
just making people understand where you are with this study, because the issues being raised, some of them is my thinking that it could be because of the stage of study and all that, but give us a bit of context. Did we lose him? Moses? Did we lose you? Oh, you are on. Okay, good. I can see you now. Yeah.
Okay. Yeah, so I'm on now. You can see me now?
Yes.
Yes.
Okay. Yeah, so maybe let me start by clarifying one thing. And this is the issue of school attendance. We see that it was proxying. It was being proxied by a household having the kids from a household, or the children from the students having a kind of a modality of learning at home, maybe using television, using internet, using a radio, because that information was there. Yeah, so if any of them, if a student was using those modality, then we are saying that they are attending to school, because as you know, the closure of school meant that students were not going physically to school. So it's here we are trying to talk about the learning, which is proxied by having those kind of learning modality for the kids, either provided by the parents or even provided by the school. You remember those days where schools were had programs that they were teaching their kids. Yeah, so having said that, let me turn to Professor Akini's comment. I do agree with the professor that we still need to do some checks. For example, the 100%, I think we need to check on that, see whether what would have been the issue perhaps is also. So the other issue which also is very key is the issue of bring the intuitiveness of some of the results that we got so that we don't dismiss a result because you see this coming from the data. So perhaps we can try to think around why are we getting the kind of results that we have. And of course, that one was also mentioned by Kuma. Yeah, so I think that's the main area I noted with Professor Kini, that is really for the fact that we have to put explanation for each and every result that we have, so that we can also demonstrate that we have done more, that we have also some kind of understanding. We have also interacted with the findings, even going further and looking into the literature whether there is something that disabled people. But difference is important. That one we are going back into that. Yeah. So then
you are breaking, Prof. You are breaking. I don't know whether it's your internet.
I think we lost him, Prof.
Yeah, it was
okay. He's back.
He's back.
Good.
Okay,
yeah. Okay. So I lost myself. So yeah. So So what you are So that count variable there actually was a mean what we are calling our instrumental variable, because from the data set we could not get a good instrument, and of course there is a way we transform that in so that it does not become endogenous, as you have suggested in your elaboration. Yeah, something else that I have also liked, and I think we are going to visit, is actually the issue of H squared. Yeah, sure, because we are talking about the. I think we took the nonlinear, and of course did our assumption that this is an aging kind of the owner of the household. But I think again here, yeah, it's true. We need an H squared here to see how well actually this age affected the kids. The age of the parent affected the adherence of the student. So also the other issue is no schooling. I think no schooling as okay. Those were the dummy variables that we had there. Yeah, so we and also the other ideas about the policy issue. Where we are saying that some of the policy that we suggested need to be interacted with our policy variable within the model, so that we can see whether what we are suggesting actually could give us some results that would help us come up with a policy a pronouncement in our results. Yeah. So. Yeah, so okay, Professor Winnie, you talked about the 5 waves. Yeah, so the 5 waves, of course, this was a panel data. Which meant that there could have been some kind of drop, but the idea here is we are repeating, or they were repeating the same individual over those 5 waves that we pointed up there. Yeah, so also we need to really interrogate the old people who age calculate for the context of age. Why? I think I need to get that one clearly. Share. You talked about old people, and we need to clarify how the old people affected the schooling for these for the kids. I think that's what we meant. So it's like we were saying that educating. So you talked about educating why educate the old people. So I think this was a discussion that resulted from the outcome from the finding about the old people and why how they were affecting the schooling of their children. So we thought that perhaps what we need to do is also to let them know that COVID at that particular time was not was not supposed to be very sensitive in terms of young ones. That is number one. Number two, it could also be the case that these old people did not have money to buy gadget and all that kind of stuff. So that now when we are talking about the cash transfer, this is where we would expect that they would be helped, perhaps in the context of the data, to help their kids access those modalities of learning. Yeah, so that is what we had in mind. Maybe I want to leave I would want to leave the floor again for my colleagues if there's something that they want to add. That is what I have for now.
Thank you very much, Professor Murithi. Others will weigh in. I think there is an ongoing discussion about data and how you complement data with qualitative analysis and all that. And that's coming from Professor Mwabu and also Njoka. So Njoka, can you go first, give a little bit of your inputs on that, and then we'll have Professor Mwabu just weigh in on this issue of data and how to kind of solidify this work. Njoka, John?
Thank you, Chair, Professor Winnie Mitura, and thank you for the opportunity, and thank you, Professor Moses, for the presentation and representing as well. I have just commented there, and also thank you, the discussants. I have just commented there, agreeing with Professor Mwabu about the augmenting of quantitative data with the qualitative, particularly on matters where statistical significance may not be strong. And as part of the team, I get the message from Paul Rakuma about acknowledging that level of significance in the results. What I would like to comment also as a matter of context is that when we were doing this work, we were not heavily going for the qualitative aspect because we are working with the World Bank data set, which is quantitative. Perhaps that is a dimension that we need to think about how to tweak, but the work already reached the level of reporting. So it is something that we can discuss after this. Then the second thing is I have seen, I think it's Mase Mogo, Dr. Mase Mogo asking about whether this was a pre and post COVID study, and the answer is no. It was not a pre and post, because even as we were doing at the data sets, it was within COVID, so you can't talk about pre and post. And that, I think, could answer also some of the questions that were being raised. The other points have been addressed by Professor Murithi, and the other colleagues may want to address other issues. Thanks, Prof.
Thank you very much, Njoka. And I think that has cross-referenced Professor Mwabu. I know Njoka is part of the team. Professor Mwabu, do you have any other comments to make at this point? Professor Mwabu?
These people, they have lots of time.
Okay, we are not having Professor Mwabu. Mercy, do you have any cross-reference of what has been said on your points? Mercy Mugo, Dr. Mercy Mugo.
Thank you, Chair, Professor Winnie, for the opportunity. I was just, Dr. Joka has actually responded to one of the issues I was struggling, because I thought that we are looking at before COVID and after COVID, and then comparing the attendance and trying to see whether there is any impact there. But that question has been addressed. The other issue that actually more of a suggestion, thinking that it might be interesting to hear about the inequalities, because I think during the presentation, Professor Muredi mentioned something about the inequalities, and we are all aware that I think there are gross inequalities, especially in terms of access to TV, internet, and other modes of teaching or learning during COVID-19. Of course, some students did not have access to these kind of facilities, and it might also be interesting to see how these affected quality. But now that the question of the pre-post has been answered, perhaps this might form areas for further research to try and understand the impact of these shocks on quality and attendance of education. So I think mine is more of a suggestion for the improvement of the work forward, if it is possible. But if not, then it's a further area for research. Thank you very much.
Thank you very much, Mercy. Back to Mary Mwangi, my colleague who is supporting me in checking the charts. Mary Mwangi, are you able to capture something beyond the two that have captured, or three? The floor is yours, Mary Mwangi. In the interim, as Mary looks, let Herbert Wamalwa weigh in. Herbert Wamalwa, the floor is yours. In the interim, Mary, keep checking the charts and be ready with after Herbert, we'll go to Paul Karaoke. Herbert, go ahead.
Yes, thank you very much, Professor Winnie Mitula, for chairing, and also to Professor Muredi and the team who put together the paper and the presentation, and also the discussants. I'm just following up on this issue of technology, which has been mentioned a couple of times, including it was mentioned that for some reason it comes up in the policy recommendations, but I think the second discussant mentioned that it was not there actually as one of the variables. And I'm curious, maybe just from the team, if they can also explain to us the reason why it was left out in their discussion. Is it that it was not captured by the World Bank when they were doing these interviews, or it is just the team that did not elect to use it as a variable? Because also we are we saw that it was during the pandemic, technology was quite an issue. Also explaining the inequalities that those who are in private schools continued with learning because they could be able to access the necessary infrastructure, whether it is bundles or Wi-Fi. Whereas those that were in public schools probably could only rely on radios and what was also offered in television. And we also know that because of the structure of our society, even this, we cannot say would reach out to all the public schools around in Kenya. So why I'm just curious why it was not a variable under analysis. Yeah, thank you very much.
Thank you. Thank you very much, Herbert. They'll keep notes. Just let them keep notes. Let's get to Paul Karaoke. Go ahead, Paul Karaoke.
Yes, thank you so much, Prof. Mitula. I'm in Durban, South Africa, School of Information and Management and Public Governance. I'm curious to know, first of all, I want to thank the presenters. I think it's a very interesting study. I'm just curious to know, since it was done, this study was done in 2021, and that was just around the time of COVID. I would like to know how is the education sector recovering from the shocks that came through that episode? And maybe because there could be a situation where the shock on education sectors as such could have declined, but I didn't think I had it correctly from the presentation. And then maybe because you may want to use this study as a baseline for future research, it could be useful to know how is the sector responding and recovering from whatever the study may have found at the time. on the implications of the pandemic on the education sector at large. Thank you very much, Prof.
Thank you very much, Paul Karaoke. Let me get back in the interim to Mary Mwangi. The floor is yours. Can you flag out if there is any other question that has not been flagged out? Any, Mary Mwangi? Mary Mwangi, are you with us?
Or Douglas, Prof, if Mary is not ready.
Or Douglas? Or Douglas? Basil, you are the backup if they haven't seen. Have you seen anything that we have left out in the panel? In the chat room?
I think most of
okay, any other hands up? Any other person who would like to comment? In the interim, let me have the team answer that. Murithi, Professor Murithi, you can be responding to the issue of technology and the issue of whether the education sector is recovering or not, as we see whether there are other hands. Professor Murithi.
Yeah, so thank you. Thank you, Herbert, for that comment. Mishuke, actually. I think it's from Mishuke. Yeah, the issue of technology. Yeah, so yeah, we didn't mention it directly, actually, because technology, unfortunately for this study, was more or less a dependent variable, because we are trying to look at whether the student used the available technology, but yeah, so we can say that we don't have it directly in our explanatory variable, and that's something that perhaps we might want to look at, so that as Dr. Professor Kani was saying, and also about the interaction, trying to interact some of these variables with what we have, to actually see whether making that kind of an assumption would work, because we thought of it on the dependent side. Yeah, so that's something that we need to look through, so that we make again comment. I mean policy suggestion depending on the variables that are actually within them. So Karaoke Paul, you talked about have you looked at how the education sector is recovering? Yeah, so we can say no for now. Maybe that would be something that one might want, either you do a qualitative or qualitative data, because the data we had, there was collected data that was not really information about recovery at that particular time, because it was still within the COVID period. So I don't know whether my colleagues have
Paul
something
Kamau,
to add.
I think, has hands up. He can complement. Paul Kamau, Professor Kamau, go ahead.
Yeah, thank you very much, Chair, and thank you, colleagues, for these very interesting comments to this paper. Let me just also appreciate the responses that my two colleagues in this paper have given, Professor Murithi and John Joka, in terms of the issues that have been raised, but very pertinent from Professor Akini, from Paul, and also Professor Mwabu. We take note of these comments in terms of how we can go in improving this paper. All comments quite valid. Let me provide some context. The winning is that when COVID hit the country, schools closed. And therefore, when school closed, parents were left to deal with the children at home. And there were many avenues through which parents ensured their children access education. So we are looking at school attendance, not going physically to school, but accessing learning when we could not take children to school. So the waves of this data that we have used in the analysis was collected in a panel where same households were visited 5 times in order to see whether they were accessing the technology-based learning. So it was not about going physically to school, where some of these arguments about food, about distance could come to play. So the learning was happening at home. And there was even a situation where parents could pay teachers to come and do homeschooling as a way of learning. And therefore, these studies by the World Bank were looking at that particular time whether children in the homestead were learning. But of course, being a household survey, it collected background data of the household head and the parents and the way the economic structure of the household. So this is the kind of data that when we were doing this study in 2021, we had in access. And that's what we have used for analysis. We didn't collect also this data directly. So what enabled students to learn at home during this time of this shock that we are calling COVID? It is a requirement. You must have a TV, you must have a radio, you must have resources to be able to bring even teacher home. So all this meant that even if we didn't have the devices as a capture of whether people are learning, was a requirement. And we saw government trying to provide gadgets for schools in order to circumvent such closures. So that's why the recommendation about transfers and also gadget availability could pay. I take note of Mr. Gashoki from Aziki that gadgets may not be the sufficient condition for learning, but we believe that in times of shock that disrupt the normal learning, that's how the gadget come into play. But we can perhaps strengthen this point. That's one of the comment I took from the chat, over and above what Professor Mwabu alluded to. It was a mechanism through which learning, so beyond having learning materials, then gadget access was very critical. Having said that, I really think that we need to provide perhaps more insight in terms of what are the implications of our finding. And these results need to be, again, interpreted with caveat that they may not apply or they may not be applicable in a normal learning situation, but we're looking at a time when there are shocks. Parents who are aged and perhaps out of working life may not have seen the essence of utilizing this other mechanism for learning. And that's why one of the and the fear around the shock. So people who are aged kept their children more enclosed than the young ones who are going to, the relatively younger parents who are still perhaps going to look for methods of earning a living. So, but perhaps we need to piece out beyond reporting the percentages, what do these mean in terms of education? So the dummy variables are there. Perhaps we need to provide more information if the paper doesn't, because again, in the presentation, we may not have gone into all the details of how the estimations were done and how we tested for the endogeneity in order to see whether there were correlations between these variables. But those are tests that we did in the resort. In terms of the meals, I think that's a very interesting comment. We will look at how we interpret it, but because it was not physical learning, then the issue of meal, perhaps that's why during this particular time, it was insignificant. Even if school had meals, then the COVID or the shock restrict movement. Finally, it's on the issue of national vis-a-vis county COVID. We wanted to see the dynamics or the variation across counties because we had the incidences at the national level where we could get percentages, but counties also had variation. So this particular variable, they were not testing the same and they may not have had the indigeneity as Lower maybe alluded to, but perhaps we need to do the statistical analysis and report on this. So this work is still ongoing. We have not reached the final stage. So these comments are very, very important in enabling us rewrite, revise, and improve. And we do take this very positively. It throws us back to the drawing board so that we can make it more contextual in terms of our findings. Thank you, and back to you, Chair.
Thank you. Thanks a lot, Professor Kamau. I just want to give a last chance to Peter. Peter Okello, are you online? You had engaged with the issue of significance of research and the threat to collapse it with those insignificance levels. And you've also raised another issue on the last one you've just done now with deepened reach of basic education. So are you on board still, Peter? Peter Okello?
Yes,
Okello.
yes,
Peter,
yes.
yeah, go ahead. Go ahead and make your observations and engage with us.
Thank you very much, Professor Mitula. My concern was on the quality of data that raised the results that were deemed to be insignificant. So I was wondering whether if we got an insignificant result, that would be a necessary condition to collapse the whole research. And two, I was looking at the use of not going to school or not having gone to school as a variable in this paper. And therefore, I was wondering whether in the view of things that many parents, many guardians of school-going children born within the age cohort 1970 to 2000 would really find very few.
Mute those ones. Sorry, Okello, go ahead. Some people are in the background. Go ahead.
Given that cohort of parents and guardians, we'll probably have very few who may have not gone to school. So this again might be an issue that Professor would like to look at and improve on the data sampling. Thank you.
Thank you very much, Moses. I want to give you the last word. We have a minute for you or so if you have anything to add. And also the discussants, a minute each. If they have anything to add, we want to bring this to a close. Moses?
Yeah, so thank you. Thank you. That is, is it Peter? Yeah, so Peter, Peter, thank you so much for your observation. Yeah, of course, in many instances, when you talk of an insignificant variable, normally it also implies that perhaps you might not have you might not have a lot of confidence in talking about it as a policy variable. But we know there is a lot of literature currently that also talks about insignificant variable being important, and also we don't take them out of our policy. Yeah, so there is that in the literature. The other issue is you have talked about insignificant, then the issue of the age. Yeah, you're talking about those people who are aged. Yeah, remember that we are also looking at children who are also at the university. So which implies that perhaps parents who are aged could still be having the that's why we could not throw out and say that we are not going to look at the very old, because we know that you have kids at the university. Of course, you're also likely to have you're also likely to be quite advanced in age. Yeah, so that's why we could not draw that. We could not put a caveat at that. But again, given that we have also not done our age squared, perhaps we get even more information once we do the age squared as our check for a very, very aged people. Yeah, so that is what I have. Maybe.
Thank you very much. I think we are running out of the time. Can we have Olainka give us a word or so, 1 minute maximum, and then we have Paul Lakuma again, another 1 minute. Prof, where are you, or did we lose you? Olainka, Lonson?
I'm here.
Okay, go ahead. Go ahead.
Thank you so much.
Go ahead.
Well, I don't have much to add, But it's, I think one thing fundamental, even some of the discussion, the reporting, for instance, when your report was made on Oban, I mean, those were in terms of location. This is better presented relative to rural, so that we know that the Oban you are talking about, the fact that attendance, well, if you are located in Oban, is so percentage higher than what? It should be comparative. There's a number of issues that are comparative. Now, I also have there's a particular section of that paper where you are doing the descriptive and saying that 6% are male. I don't really understand, because we only have two gender, male and female. If the female are just 6%, are you trying to talk about the fact that that data you used, 500 plus, was mainly dominated by female? There must be an error somewhere. Maybe you want to write 50 something, or you want to write 40 something. I do not know. Those are the kind of things that I need to actually take my attention to. And I also noticed that just less than 1/4 of children were owned by, belongs to the head of the family. So it also that raises a question. How can more than 75% of children responding to that data do not belong to the head of the household where they live? That's an issue that needs to be explained, or need to discuss that, this is the reason why we found it. Maybe in Kenya, once you give birth, you always say, go and live with my brother, go and live with my sister. I mean, that's what he's trying to say. That's why I said telling the story, when you get the result and you say, what is the story behind this? You'll find that it can also help you to discover the error you have made and be able to correct it. Thank you so much.
Thank you. Thank you. Thank you so much, Prof. Let's go to Paul Lakuma. Your last words or final observation, Paul?
Yeah, when it comes to the percentages in the regression, I think we need to be careful what we are suggesting to the authors. The percentages here are not how would I call it? A process has gone through of establishing variation over covariation, a ratio between variation over covariation of many variables. That's how these percentages emerge. They are not a direct ratio of, let's say if it's gender, female over the total population, the way the professor was putting it. That's not the case. That would be in the descriptive table. That's why the percentages in the regression do not have to add up to 100%. Careful there. They don't have to add up to 100%, because regression is going back to, it's using a sample to go back to population. So it's variation over covariation of very many other things. So in that black box, the percentages which emerge are not necessarily the normal percentages we have, where if the females were 6%, then the males are 94%. Then they should add up to 100. That's what I wanted to make very clear. That the percentages which emerge from regressions are completely different from the percentages we know from summary statistics. My last comment is, the authors are right in the way the percentages are calculated in the regression table or table 2. My last comment is in the objectives, the way objectives are laid out. Policy recommendations should not be part of the objectives. I forgot to say that. There are 3 objectives in the paper. Yeah. One is analyze the impacts. The second is magnitude of differentials. And then the third is suggest policy options. Policy options is an outcome of the study. It's not an objective. Yeah, so we should remove it from there. It will just emerge. Policies will come out of the results. Thank you.
Thank you very much, and more so for that, your last caution. It's a very common one. You read studies and policy has become an objective when it's an outcome. A very good learning. So I really want to take this opportunity to thank the presenter and the entire team in this project for a very good presentation. When you have this a presentation where there is this intense kind of discussion, it means it's a good is a good theme you have and is a good work that is going on, which we expect soon to read in journal articles or in book chapters or in other series. So thank you very much. And then I also want to thank the technical team led by Basil and the entire team behind the screens that has made this possible in terms of planning and ensuring that everything has gone on very smoothly. You do acknowledge that this cannot be summarized, the work that has gone, the discussions that we've held, and it just pays to have been among the 72 participants who are in the room to take home what we need to take home. But thank you very much. We want to bring this to an end. We are running 10 minutes late, but I guess, Basil, that's not so bad. So I want to hand it back to you, Basil. Thank you. Basil? Basil?
Thank you so much, Prof. I was trying to unmute myself and also sharing the link for our next week's seminar. Please look out for the link, look out for the University of Nairobi and IDS social media platforms, LinkedIn, X, formerly Twitter, and Facebook page, and we stay in touch. Thank you so much, and just adding a voice to yours, Prof. Asanteni sana.
Thank you. You can open your cameras for those who want to see each other as Basil sends us off. Thank you very much, everybody, and bye.
Thank
bye.
you.
I can see Paul Kamau there. I can see Moses Murithi
Bye.
there.
Thank you very
Bye-bye,
much.
everybody. Bye. All the
Yeah,
best.
good to see all of
Bye.
you. Thank you.
Bye. Bye. Bye.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Thank you.
Bye.
Good evening, good afternoon, good morning, depending on where you are joining us from. Thank you so much, Paul. Thank you so much. Professor Murithi, congratulations once again on your...
Thank you, Paul Karaoke, for joining us all the way from Durban. Thank you. Paul Karaoke. Not putting a video on. Thank you, our students also for attending, our researchers, and everybody. We are truly grateful for your time.
Thank you, Prof.
Yeah.
Thank you,
the
Professor.
Management of the mics, something we need to learn.
Okay, do you want to remain behind or do I end the meeting? I can see Eunice is there somewhere, Douglas, Evelyn. We had about 170 registrants. We've managed to host up to 75 people. It's good.
Yeah. Bye-bye. Thank you, David Wanjui. I'm seeing you now. Thank you. Thank you all.